Hello everyone, my name is Dr. Henry Ho. I'm a senior consultant urologist from Singapore General Hospital. I'm also the chairman for the Prostate Cancer Survivorship Program for Singapore Cancer Society. Well, this video is made for everyone who has prostate cancer and also for anyone who knows of someone who has prostate cancer too. In this video, we really want to let everybody know the kind of work that Singapore Cancer Society has put in behind the scene to make sure every patient with prostate cancer has the support that they have beyond that of just medical care. Well, in my line of work as a healthcare provider, as a surgeon, as a doctor who cares for the patient in the medical field, prostate cancer itself is not just a medical condition alone. It also has its own psychological effect to the patient in terms of not only the patient but also to the family. Secondly, as we all know, the prostate cancer do have functional impact in terms of patient's continence and erectile function, and therefore the need to look after the patient's ability to recover from all these side effects of the cancer itself is important. And this is where the Prostate Cancer Survivorship Program is meant for, whereby it allows the patient to learn and to interact with other patients such that they're able to learn what to do and how to cope with all these little differences in their treatment options. When someone is in the doctor's office, and you know it's can be quite intense, it's crowded, and sometimes when you're under that kind of environment and someone gives you the big news of the cancer and the C word, your emotions just get overwhelmed and you get very shaken and depressed immediately. I think this is where I think you have a much more comfortable environment, more conducive environment to think through the options and to absorb the news and the implication of the news. I think that's much better. And that's where the prostate cancer nurse come in too.
I'm Sarah. I'm a urology specialist nurse in Tan Tock Seng Hospital, and I subspecialize in prostate cancer. I sit in with patients who are newly diagnosed with prostate cancer. Patients at different stages of their prostate cancer, they do require different treatment options. So most commonly, most people would hear that when you have prostate cancer, you are able to go for surgery. So after surgery, there are some side effects, and the main side effect would be urinary leakage. And I do teach pelvic floor exercises to them to help them cope with the urinary leakage. And besides that, patients who undergo radiotherapy treatments, they do experience some kind of increased urinary frequency, urgency, and leakage. So I do ask them to do bladder training. Patients who go for hormonal therapy, they do experience some side effects, mostly mood swings, tiredness, weight gain, and these groups of patients, they do require a bit more counseling, advice, how to overcome certain side effects.
我叫江燕，我是从国立大学医院泌尿专科来的高级护士。我的现在主要工作是做前列腺癌症的专科护士。当他们知道他们的癌症之后，他们可能会比较担心说癌症会怎样影响到他的生活，这些治疗会给他的生活造成什么样的负担，这些我们会根据不一样的治疗方案，然后再跟他讲说可能出现的问题是什么，然后这些问题我们可以有什么样的解决方法，然后我们需要你配合，需要病人配合来解决这些。但是病人同时也要明白说不可能完全是没有改变，但是改变可以减少到最少，如果他根据我们提供的一些方法来做的话。
My name is Karine. I'm a senior staff nurse. I work in Singapore General Hospital as a prostate cancer specialist nurse. My job is to navigate them around in this healthcare system, because this healthcare system can be quite complex, especially when they're ill and then they do not know who to turn to and how they could get referred to certain services. As a patient, I think that they can turn to this existing prostate cancer support group called Walnut Warriors in Singapore Cancer Society for assistance. So basically, Walnut Warriors support group consists of existing patients that are diagnosed with prostate cancer. These prostate cancer patients are either currently receiving treatments from their various hospitals or they've undergone treatments. It would be ideal that these One-Out Warriors to be guiding the newly diagnosed prostate cancer patients in their treatment journey as well as the route to recovery. So usually when I tell my patients, right, I like to tell them that I like to describe this One-Out Warriors as street lights to illuminate their path to recovery.
I had a good talk with this SGH, Karine Sim, and it was also through her that I became a member of Cancer Society. So I joined first without knowing about the support group. It was the best thing that happened to me. After I joined, I went there, I found that it was an exercise, a man-planned exercise. After the exercise, I was introduced to everybody. And everybody was so friendly, you know. They make you so much at home because we are all the same kind. One of a kind. Right? One of a kind. So we are all in the same group. We can relate to each other so easily. You know, we can open up to them. So they are also a form of support, and this is very important to us. People with our condition, with this support. You know, our family may support in another way, but it's sometimes very difficult to relate our problem to them. But with this support group, we have people who have gone through this thick and thin, people like Winston, you know, who has gone through thick and thin of it, and he has lots of experience, and they share their experiences, and we can absorb, you know, and learn from their experiences what they have gone through. And it makes things much easier for us.
I think those 3 nurses will be indispensable for new patients.
Yeah. I think they're very good. They're very good. They teach us what to do before the op. In my case, before the op and after the op. And even after the op, you know, anytime you have problem, you go there, she still recognizes you, she still help you out, you know.
Well, a number of the warriors have undergone some training to, I guess, learn how to interface with new patients. Not to give advice, but to listen to their story, to share experiences we have. So we try and match ambassadors who had the experience that these people are going to go through themselves. And that helps to a large degree. I think that people know, get some comfort out of knowing that there's other people who've been through the same process as well. Right. And then when they come into the group, they just feel a lot more at home.
At that time, SCS, we had the service center at Bishan Junction 8, so it was very ideal. We already had the space for us to conduct support groups there. Yeah, so we managed to get together about 13 of them to kickstart the program, to kickstart the interest of having support group. All our services and programs are at no cost. www.singaporecancersociety.org.sg.
We certainly haven't stopped living. We enjoy life and sharing our experiences together. You'd be most welcome to join us.
I feel that even though you are diagnosed with cancer, it's not the end of the world. So don't give up. In life, there's hope.
Cancer is not only a word. It's not a death sentence. Be brave and face up to the illness.
Do not despair. You are among friends.
Fear not. Options are widely available. Speak to your urologist to guide you through the various options. And I think definitely if you're in an early stage, cure is definitely an outcome that you can expect yourself to go for. I think if you have any kind of questions or worry, I think you can always approach the prostate cancer specialty nurse from the various hospitals. At the same time, if you still have other questions that you think you want to seek other form of help, I think that's a kind of resource that Singapore Cancer Society can provide in the form of prostate cancer survivorship program.
Don't give up. Keep fighting.